Number one, it's passion, okay, to get passion for taking care of children. Okay, number two, it's to build confidence in the doctors to be able to do that, eventually leading to my third word, which is mastery. The most important reason is to develop that mastery. There's a lot of chiropractors who look at kids as a small adult and adjust them like a small adult, and it's not proper. So I want to explain to chiropractors, I want them to have an understanding and mastery of how to really work with kids. My class is the Essentials of Chiropractic Care for Children, and basically what it does is it tells people how to develop their office for kids, how to approach kids, some techniques to start to get hands-on with the kids, and we also go through how to do a report of findings, how to do a patient orientation, and at the end we talk a little bit about child abuse, just basic recognition to really start a kid's practice. The parents like to have a heart-to-heart connection with the doctor. In other words, if they're going to have their kids get chiropractic care, they want to feel the love and the caring. And that's what my class offers, and that's what my class brings to the members, so that they can exude the love and caring that's needed for the parents to feel comfortable with chiropractic care for them. I think that is critical, okay? One of the reasons some chiropractors fail at the pediatric practice, they talk too academic and they talk too research oriented, which is all good and needed. However, the parents like to feel the heart-to-heart connection that comes there. You become the expert in your field in the area. In other words, in my area, they know when there's a child or a pediatric question or case, or they come to me, okay? And the DCs who take this will get that reputation and that skill level, and like I said before, the mastery involved with this to really help and be their focal point in their community for kids in chiropractic. Absolutely, parents recognize it. I get referrals from midwives all the time. I have a number of people who come even from out of state. They come over to get a second opinion or whatever with that, and we work with that as well. One of the things about my module that is very practical oriented. It's things you can take home, do in your practice the next day. It's ideas, it's concepts, it's introduction to techniques, but things that people need to learn, like how to educate. Doing the orientations, how to do a report of findings that's based upon bringing the family in. Okay, things along that line. I think that's important material for people to understand, because every chiropractor I know does a report of findings, but not everyone I know does one that stimulates the children. And the big thing that we do, and I think is important, is to teach the docs that we're correcting the subluxation. We're not treating conditions, okay? And by doing that, it's like I say in the beginning, okay? If you're looking at chiropractic care to treat a musculoskeletal condition, then why would you adjust babies? But if you're looking at correcting the vertebral subluxation, not because of a condition, but just because a vertebral subluxation is present to correct it, then why wouldn't you adjust babies?